Jared Weaver takes the hill tonight, his 21st start of the season as the Rangers get set for Game 2 of this 3-game series at the Big A. Time now for the medical side of baseball. We are joined by Keck Medicine of USC insider Dr. Alidad Ghiassi. He's the assistant professor of clinical orthopedics. Want to make sure I got that right.
Thanks, Kent.
Doctor,
yeah, I appreciate it.
Thanks so much for being with us here. And when we talk about baseball, you hear about the shoulder injuries, the elbow injuries, especially when it relates to the pitcher. But the hand and the wrist, also very important. Why do those go a little under the radar?
Yeah, I think one of the reasons is that, you hurt a large joint like your knee or your shoulder, you tend to swell up right away and seek attention. But you sprain your wrist or you hurt your wrist joint, it doesn't swell up that much, and most athletes tend to ignore it and they ice it, and then they find out they had a bigger injury later on.
What's the percentage of wrist and hand injuries that you come across?
Well, I mean, I'm a hand specialist, so I see a ton of it.
Yeah.
But in the upper extremity, it's the hand and wrist is one of the most common injuries that you see.
Yeah.
More common than shoulder and elbow.
Now, it doesn't have to be an impact injury, does it?
Yeah, it really doesn't. I mean, you can just get it from a fall, or even a twisting injury, lifting something. You can get it too. And most people who get these injuries don't really present to the doctor right away. And even if they do, it's very difficult to diagnose because initial x-rays are normal, and sometimes fractures show up at 4 or 5 weeks down the line. And on occasion, you need an MRI or CT to diagnose them. And the key to diagnosis, early diagnosis, is really important because it factors into your outcome. So if you catch the injury early, if you treat it early, you usually avoid surgery. But if you ignore it and it's caught later on, you may need surgery, and the outcomes aren't as good if it's treated later on down the line.
Well, the Angels have faced some of those injuries this year. One of them, Colin Cowgill, he's back in the lineup tonight after missing 84 games with a right wrist sprain. Why does it take so long to recover from one of these injuries?
The ligaments in the wrist are really tough to heal. They're small ligaments. They don't have good circulation, and they don't always heal completely, and it takes a long time. A wrist sprain itself can take a good 2 to 3 months to recover from, while a fracture in the wrist may even take like 6 weeks. So a sprain in the wrist is really difficult to treat.
And Doctor, you gave me some great piece of information talking about the force when you're swinging a bat.
Yeah, that's amazing. If you're looking at the forces involved in a baseball swing at hitting a 90-mile-an-hour pitch, it's about 8,000 pounds, and that's equivalent to 22 NFL linemen hitting you at an instant on the tip of your wrist. And that's that's how you can get these injuries. And these athletes are amazing because they're trained and they're very strong. But if they don't hit it just right, they can injure themselves. So all that force is dissipated right to the wrist joint.
That's amazing. Well, Dr. Ghiassi, thanks for enlightening us a little bit on the injuries, and thanks for spending some time with us.
Absolutely. Thanks for inviting me, Ken.
Enjoy the game.
Absolutely. Thank you.
All right, we're taking a timeout here on Angels Live, but when we do come back, it is now time to talk about the case. Jared Weaver taking to the hill tonight against the Texas Rangers.